went out to all physicians from the medical board saying, any physician in California who writes an inappropriate exemption for masks or other COVID-related measures will have his medical license subjected to investigation and disciplinary action. So for a physician, just to help you to understand, this kind of threat hanging over your head is worse than the threat of getting fired. If I get fired from a particular healthcare organization, I can go to another healthcare organization or go start a private practice. If I lose my medical license, I cannot practice medicine. Okay? That's how serious this is. The letter never defined what might constitute an appropriate or inappropriate mask mandate. So I have no idea if I write a mandate for a kid with a severe anxiety disorder that's worsened by the wearing of a mask, is that going to subject my medical license to disciplinary action? Physicians in California interpreted the phrase and other COVID-related measures to include vaccines, which had already been rolled out at that point. It has become de facto impossible to get a medical exemption for a COVID vaccine in the state of California. No physician will write them, even when you have someone that has a contraindication listed on the CDC's list of contraindications to COVID vaccines. I have a patient, went to her rheumatologist, specialist in her autoimmune condition. This specialist told this patient, I don't think you should get the COVID vaccines, given your age, your low risk of COVID, and I think there's a good chance that these vaccines, based on the data that we have, could worsen your underlying medical condition. She turned to the same physician immediately afterwards and said, can you write me, therefore, a medical exemption? Because I need one for work. There's a vaccine mandate at work. Same physician that just told her not to take the vaccine or recommended against it said, no, I'm sorry, I can't write you a medical exemption because I'm afraid I might lose my license.
Are you telling me that patients who have known life-threatening contraindications
That's
to
right.
receive a COVID-19 vaccine indeed are not being given exemptions?
So